Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and greetings to everyone. Honorable Chief of EB Organization, Dr. Amy Nurjasmi M.Kes, Honorable Co-Founder of Media Medical Community, Mrs. Fani Cynthia Rahmi M.Kep, Honorable the Moderator and 4 speakers from 3 countries, Fatemeh Ghodsi, M.Sc from Iran, Leila Mustofi Ph.D, HCMC from India, Tiyas Kusumaningrum S.Kep, Nurse M.Kep from Indonesia, and Mr. Kamal Kasra S.Km MQIH Ph.D from Indonesia. Especially to all the participants who have joined in this Zoom room. Welcome to International Seminar Session 2 with theme Healthy Family Planning and Forming Healthy and Normal Mindset of Pregnancy, Childbirth, and Postpartum, conducted by Media Medical Community. I am Devi Noviana Rifani as the Master of Ceremony for this event, and we are very glad to meet you in this seminar. Praise to God for all His grace to let us join the seminar to gain more knowledge from extraordinary speakers. First of all, as this seminar is conducted by Media Medical Community, please welcome the co-founder of Media Medical Community to deliver her welcoming speech to Mrs. Fani Cynthia Rahmi, M.Kep. Time is yours.
Okay, good afternoon, everyone. Okay, we would like to say thank you to all speakers and all participants attending in this seminar. This seminar is the second session on this event for today. So I would like to announce that the second seminar is starting. Thank you.
Ladies and gentlemen, now we are about to start the main agenda of this seminar. Therefore, we would like to invite the moderator to lead the discussion and the speakers to deliver their presentation as well. The discussion will be led by the moderator, Ms. Rima Wiranfiona M.Kes. Ms. Rima Wiranfiona M.Kes is a graduate of Erlangga University of Indonesia in Reproductive Health 2020. She is also a writer and content editor related to parenting, character building, and health. She has already released 5 books, in which 2 of them were a result of collaboration with government. She is also active in becoming surveyor in some researches. So without any further ado, please welcome Ms. Rima Wiranfiona M.Kes.
Terima kasih kepada MC. Allow me to use both of languages, Indonesian and English. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, salam sejahtera bagi kita semua. Welcome to the International Online Seminar with the theme Healthy Family Planning and Forming a Healthy and Normal Mindset of Pregnancy, Childbirth, and Postpartum. Honorable to the great speakers, Midwife Leila Mustofi, Ph.D. HCMC from India, Midwife Fatemeh Ghodsi, M.Sc. from Iran, Bapak Kamal Kasra, S.Km MQIH Ph.D. from Indonesia, Ibu Tiyas Kusumaningrum, S.Kep Nurse M.Kep from Indonesia. Praise be to God, because of His grace, we can join this seminar to enhance our knowledge. Distinguished speakers, participants, and ladies and gentlemen, we inform you, seminar participants can ask questions during these presentation sessions either via Zoom or YouTube channel. Please type your name, institution, or city of origin, and the question addressed to which speaker. Peserta dapat mengajukan pertanyaan melalui kolom Zoom atau YouTube dengan mengetikkan nama, asal kota atau institusi, dan nama pembicara yang dituju. Silakan menggunakan bahasa Indonesia karena nanti kami akan bantu menerjemahkannya. Dear speakers, we inform you that each speaker will deliver material for 20 minutes, and after that, at the end of the sessions, it will be continued with discussion sessions. All right, might I now invite the first speaker, Midwife Leila Mustofi. She is registered as licensed midwife with master degree of psychology at PNU University and master IT management in medical at Tehran University. She has rich experience as senior consultant midwife, international midwifery trainer and lecturer, and international midwifery project manager at Kasra Specialist Hospital. She also been trainer of psychological birth internship and researcher in psychological safe birth through midwifery. She is going to give us presentations on the topic providing a safe and comfortable normal delivery. Midwife Leila, time is yours.
Thank you. Hello everybody, Salaam alaikum, ahlan wa sahlan, and very nice to see all of you beautiful face and shining, glowing girls and gents. So thank you so much, Rima, for inviting me and for your nice introduction. Thank you from Media House for making this fantastic, fabulous meeting. It is an honor for me to participate in your Jakarta International Seminar. So I don't want to introduce myself because Rima introduced me, and just I want to add that nowadays I'm living in India and I have project management and counseling for midwifery-led care units in India. So I start with my presentation to talk about how midwifery work in different countries. Is it possible I share my PowerPoint, please, Rima?
Yeah.
Can you please give me access to share my PowerPoint? Thank you.
Okay, please committee to allow share screen. Yeah,
Thank
please
you.
wait.
Thank you. Yes. I have to go to desktop, I guess. Where is the desktop? Wait 1 moment. 1 minute, sorry. Just 1 minute. Okay. Thank you. Thank you to being patient with me because I'm on the road, unfortunately, and I'm trying to connect it properly.
Midwife Leila, how about
Yeah.
if the committee help you to share screen?
Yeah, I'm getting access to that. Yes, yes, yes. It's okay. Yeah. Can you see my screen?
Okay, I can see.
Oh, okay, great, nice. Can you make it open? Yeah, 1 moment, please. it is sharing. Thank you. So I'm going to talk about providing, thank you, providing comfortable and safe normal birth. As a midwife, as a consultant midwife, we have many issues in different countries, and we have to know what is safe birth for each country, because each country, they have safe birth definition. I want to tell you about my experience about working in UAE, in Dubai. Safe birth was providing antenatal care according mother's demand. In other countries like Iran, safe birth was providing privacy and individual care for mothers. For other countries like Georgia, where I was working, it was meaning you give normal birth without tear and episiotomy. And the other country like India, safe birth means mother with low invasive medicalized interference. But if not get meaning without safe pregnancy. If we want to provide safe birth, first of all, we have to provide them safe pregnancy. Because if a mother can get safe pregnancy services, we can provide them in proper way of safe birth. In some country like Georgia, safe pregnancy means taking care of their diet, taking care of their psychological, emotional, and informative support. In UAE and Dubai, safe pregnancy means reduce mental and physical complication like diabetic, like insulin-related issue, and overweight. In some country like Iran, safe pregnancy means provide emotional support, and in India is providing informative support, prenatal class, psychological and emotional and informative support. So first we should talk about safe pregnancy. Safe pregnancy care should provide by midwives who are expert in that. Most mothers in some Western countries and some other countries that I was engaged in their midwifery project, they were following their prenatal care by gynecologists and obstetrician. Obstetrician, they are very good for complicated pregnancy, for complicated birth, but they don't have time for counseling for normal birth and preparing class and childbirth class. The other issue is very important to provide the foundation of safe birth is prenatal services and support. According every country culture, every country expectation, we have to provide these services and support it. And birth support is the most important issue that we were engaging in different countries. Some countries like India, still we have medicalized birth. So we need birth support. We need husband, doula, midwife, and birth provider. In some countries like Dubai, UAE, and Dubai, we need some midwifery care. In Iran, we need more facilitated LDR room. In other countries like Georgia, we need more experienced midwife to support birth and spend time with mothers. And about birth team, yes, for having a safe birth, we need a birth team. Team is the most important things that a midwife and a consultant and a midwife leader should provide to guarantee mother's safe birth. Team is including gynecologists, obstetrician, neonatologists, your midwife assistant, your labor suit midwife, your doula, your prenatal care midwife, your workout midwife, and all together should have very nice teamwork that can provide this safe birth for mothers. Family support is very, very important component of safe birth. Why I came to this issue? Because in each country, I found family support is the most important element to provide safe birth. In some countries like India, family bonding has so much meaningful. In Asian country, we need family support. But first, we have to provide this facility and training and proper sector to help to family to be engaged and get information and support. And birth facilities. Birth facilities depends to the culture and demand of the clients in each countries. Some countries, they like to have privilege and individual birth rooms, birth facilities, and services. Pregnancy and birth in different countries. As I mentioned here, I was working as a mentoring for midwifery student of University of South Australia, Dubai government, Iran University, and Georgia David Tibildiani University, and nowadays in Apollo Cradle Hospital in India. So I found that the most important element to provide safe birth is to consider training our trainers. In my project, I was trying to provide the best midwifery training for the midwife or nurses. Some nurses, they are working in midwifery-led care, but they are nurses, they are not qualified as midwife. So in some countries, we started 18 months training course for nurses and qualified them as a practitioner nurse midwife. In between, we have to increase our independence practice for midwife. As soon as a midwife can provide independent practice for mothers, they can get more engaged together and get more support from midwifery counseling clinics. In Iran, we have independent midwife, but in UAE, in India, and Georgia, we don't have independent midwife. So most of the mothers should go under supervision of gynecologists and obstetrician and then get the care from the midwife or nurse. So that's why we need to promote and increase this facility in this country for getting safe birth. Midwifery training, as generally, we have different midwifery training in different countries. Some countries we have direct midwifery for Bachelor of Midwifery, like Iran, like UK, like Sweden. Some countries like Georgia, like Dubai, like India, they have only nurse. So for these countries, we have to try to implant 18 months course to help them to promote themselves to being as a nurse midwife and take their help to promoting midwifery in those countries. Maybe we are not able to start direct midwifery in those countries, but we can promote our nurse staff to work as a competent nurse midwife. The other things that is very important about giving safe birth is midwifery service. I kept different countries picture here. As you see in the top of the picture, I am with my mothers who delivered their baby in Georgia and our gynecology team. We are standing all together and we providing this service all together. Not only as a midwife, as a gynecology, we do this rounding in the morning together. And mothers, they will understand they are under cover of a groups. As you see, the other picture I'm keeping in the down of this slide, this is from India. I'm with gynecology partner. We are sitting together and training mothers and expectant together because these services in those countries should be with gynecology. But anyhow, we will call it midwifery services till we reach to those direct entry midwife and midwifery, independent midwifery clinic. We need to have some prenatal services. You see this picture I kept here. Prenatal service depends to different culture, different countries, and different demands of the people. This picture, it is aquanatal exercise in India. As you see, we are providing them prenatal exercise in the water and with their partner. In India, in some part of India, the culture, they accept to do exercise with their partner and they need more emotional support. When they do exercise together, they feel more relaxed and this bonding will be more intense. So we have to be creative, we have to be innovative. Which prenatal service, for which culture, for which demand in which country, you can innovate. because nowadays new generation looking for the innovative and caring services. Prenatal services, like before just checking normal vital sign and fetal heart rate, nowadays doesn't have any place between this new generation. So we have to be more innovative and prepare, design new prenatal service in our different countries. And train to trainees. We want to provide safe birth for mothers, but we need some trainers that be updated. How to do this training? Training before, it was very, very traditional training. It was only a student and teacher, but we are trying to innovate and make new module for training that students and midwife, graduated midwife, be more engaged in training and they understand practically. This is what is the reason I got awarded from University of South Australia, because they found my training very innovative. Because as students and graduated midwife and nurses, they need to touch, they need to feel the meaning of pregnancy. They should understand from their spirit, their soul, that what is midwifery, what mother needs. And according to that, they will provide care. We are not that old and traditional doctors that just read some references and be midwife. Nowadays, midwifery is knowledge of spirit, is knowledge of culture, is knowledge of society. So we have to promote our midwifery skill and our training module. And what about safe birth? Safe birth. In different countries, we should provide some media awareness project to public. In Iran, I made some water birth movie with Iran national media, and according to Islamic culture, we covered mother completely and showed complete safe birth room in water birth to a public. Because maybe in Iran and other Islamic cultures, like in Dubai, I was engaged in our media awareness project. We were trying to show to these Muslim mothers that water birth, it's not like Western movie that you saw you should be naked and no privacy. No, we can modify according our Islamic culture. You can have privacy, you will be covered fully, and you don't have any other people to look at you. So we have to be very aware, we have to be very, very smart to bring media in our awareness projects, modify our new birth culture and show to people what is safe birth. Show it according culture, according our religions, and according privacy. Then mother will like to have these services. About emotional and mental health in pregnancy. It's very, very important. As you see the picture from my clinic, mothers need to find these services in pregnancy and birth. They need emotional and mental health. Midwifery is not only tough practice, it is engagement mentally and emotionally with mother during pregnancy and birth. You should engage with mother, with her husband, with her family, and let her interact her feeling, her fear, her anxiety, understand her. They don't want a midwife as a robot. They need human, they need understanding. And about economical health, I kept one of my picture from Iran again, and you see, this is a one luxury birth. In some countries, they like to have very good services like this: husband standing, mother standing, doula standing in the front. My gynecologist team is standing back, and my doula, my midwife assistant with me. It means economically maybe increase for them. But if they like, we can decrease team charges and give them some guarantee that economically you will not go that much for, you will not go for many affordable births. We can reduce your packages with the same team in different quality hospital, but the same service. So we should be very smart as a midwife, like a business lady, businessman. We should provide different birth packages that be affordable by our clients. But we consider teamwork, we consider privacy, LDRO. And midwifery clinics and care, as I kept my mothers in Georgia, as you see that we have to try to be more flexible with clinics and care for our midwifery services. Sometime in Georgia, as you see, I went and I had to visit 7 mothers in the meantime after the birth. So we should be very flexible to find a new way to give these services even in that situation. Maybe in some country like Georgia, we don't have midwifery clinic and you have visit 8 mothers in one small hospital in one unit. But you have to be like a manager. You have to be like a leader. You have to give some idea to your staff, to your hospital, to your team that how to manage them and take care of their privacy. And as you see, there is a birth services. This is one mother from Iran. I kept this picture. Birth services should be according to mother demand and mother culture. As you see, this mother in Iran is a very religious mother, and she wants to have labor in water. She wants to have water birth. I covered her completely because she didn't want even her body to be shown off in front of her husband. We have to respect them, their culture, their beliefs. Covered completely, as you see, and I innovate this model. Maybe you cannot even think how I found this design. I imagine how I can take care of her privacy and let her have water birth. And as you see, this mother, she has MS, multiple sclerosis case. We could give her safe birth with this facility, as you see. Completely safe pool, completely covered body because of her belief, and providing some facility that keep her safe during birth. And family support is very, very important. I kept my aquanatal class in India. Family support difference in different countries, different belief, different culture. In India, for example, in that part, north of India, their culture is different by south. They like to do exercise together. Some countries like Iran, they do this exercise with couple in their private pool. In some country like UAE, we give them this exercise in water in their own beach in privacy. So it depends what you like and what is innovative, what is new midwifery. Go and look for modern midwifery services that you can attract new generation and new clients to midwifery field and safe birth. Because safe birth doesn't have meaning yet in most countries. They don't know what is safe birth. And nowadays, because of many medicalized invasive normal birth, the most population, they think safe birth is cesarean section. But you have to figure out that what is safe birth. Start from pregnancy. And sport culture, it is the most important thing as a midwife and midwife consultant. You have to aware your team and make your team a structure according to sport culture. A sport culture should be described to your client that is necessary. It is mandatory to go through exercise during pregnancy according to your convenience. And this is in India that we did the same sport culture and we are trying to go through media. As you know, it is our India project, and I'm awarded by the Media House because of I was ambassador of health and media health programmer in Iran, Georgia, and UAE, Dubai. So because of the water birth and safe, respected birth movie that I made as an independent birth, independent filmmaker, I was awarded from Media House and Art College of India, and I am one of the Juli team. Midwifery-led care projects in India, it is in 2 parts. We are working in urban area and rural area. Urban area, it is for some VIP services, private services for birth and pregnancy. And rural area, as you see, we are trying to start with basic family health training because they don't want that much luxury services. So as you see, we have many girls, many mothers, many young women. We are going weekly to rural area, teach them about family health, about sustainable family, women and girl health care and pre-marriage consultation. So this awareness prepare them for safe birth and increase their demand to going for safe birth.
Another project we are doing in India is childbirth education and informative support. As you see, we have a group of educated mothers and husbands. They are sitting and we are talking about water birth because they don't have any idea about safe birth or water birth. And I'm focusing in water birth for those society because they like to have some special birth and less painful. Actually, most of this group level of the people who are in that level of society, they're like Iran, in India, they're looking for very high developed birth and less invasive and very safe and more comfortable. So water birth, providing them comfortable birth, and they like to know what will happen and what will be get. This is one of the classes and some classes that we're providing for mothers and couples. It's childbirth classes for couple in India that we do emotional and psychological, physical support in those classes. We ask husband to accompany their mother, and they try to engage with this massage technique, helping physiological and psychological and emotional support. Husband need to be trained. So every childbirth classes should be with couple both together. And it is our hospital birth unit project in India. As you see, we are a team of specialist doctors. We are working as a multidisciplinary team, and we had water birth for mother. After birth, we had skin-to-skin contact very fast. And even after that, father, he has skin-to-skin contact and cord clamp cut by father. It is our project in India, our training project. Our mission is train to trainees. It is Apollo Hospital, then we do our training in India, and we try to do train to trainees. We trying in our mission is rural family health awareness camp in rural area. We have urban aquanatal services. Another mission in India is urban water birth services and media health awareness program that we are working from long back. Our project plan in this picture that you see, it is one in Iran and one in India, is train to educators to educate new curriculum models, continue the philosophy and content across the country, across the India. And training should be culturally and occasionally sensitive. Thank you for your time and attention today. This is my picture with my lovely team from Iran. And a special thanks to Media Medical, Media Indutana, Rima Viren, beautiful girl, LEC team, Lily Excellence Center team, and our mother company, Samco from UK. Please, if you have any question, don't hesitate to contact me. I kept all of my contact detail here, and anytime you're most welcome for any counseling or any sharing any experience and knowledge with us in India project and other countries. Thank you so much. I hope I finished in my 20 minutes, Mr. Rima. Or I want to, keep some time for question answer if you have any Q&A session.
Okay, thank you, Midwife Leila. You also beautiful. And the material presented by you motivating health professionals to provide a comfort delivery process. And about the questions, we will answer in the end of the session. So we will continue to the second speaker. Okay, we continue on the second speaker, Midwife Fatemeh Ghodsi. She complete M.Sc in midwifery counseling at Azad Medical University. She having more than 6 years of experience as a midwife in Bever Health Center and the Khoda Hospital in Qazvin, Iran. She currently serves as an instructor at Com Medical University, where she trained midwifery students on subjects mainly focused on maternity care. She accepted appreciation letter from Alborz Healthcare Institute as the best oral presentations about the effect of childbirth preparation. And on recent virtual International Day of the Midwife, she presented oral presentations about the effect of childbirth preparations on fear of normal vaginal delivery in Iranian pregnant women. And I repeat again, she accepted appreciation letter from Albert Healthcare Institute as the best midwife in 2010. In this occasion, she will deliver a presentation which is enabling pregnant women to enjoy pregnancy without fear. Midwife Fatemeh, time is yours.
Hello to all viewers who participate in this fascinating seminar. Honestly, I'm so happy for having me here. Thank you, dear Rima, for introducing me. It was completely, thank you. In this step, we want to talk about a popular problem in pregnancy, I mean fear. And we want to talk about the main reasons of this problem and how we can enable an enjoyment pregnancy without fear. I decided to describe my review article about this problem in Iran. Let me to share my presentation slides. Can you see it?
Yeah, it's clear.
Yeah, that's great. Unfortunately, according to global survey, about 20 to 80% of pregnant women suffer from a medium level of fear during their pregnancy. And notably, about 20% of these pregnant women, especially perimenopause women, show high level of fear in their pregnancy. If we want to discuss about the main reasons of fear during the pregnancy, we should consider this rule. The reason of fear is completely associated with the age of pregnancy. For example, in the first step of pregnancy, most of women worried about losing their baby, especially if they had a miscarriage or infertility problem experience. And also during this time, most of women worried about the health of their babies. They have analyzed several medical tests and waiting for getting this result. Definitely, this waiting increased their nervous again. In the middle step, when pregnant touch the first fetal movement, they get worried about they won't be able to care their child or love them enough. Fear of not being a good mother. But the main reason of feeling fear during pregnancy is about childbirth, normal childbirth or NVD. Most women concerned about this problem just in the last trimester of their pregnancy, but sometimes it is a general problem in whole pregnancy. According to the data, fear of childbirth is mainly associated with increased the number of cesarean section, and which is one of the important negative consequences of this problem. As we know, childbirth is a natural phenomenon and its mechanism is a spontaneous process with no need for any intervention. Just in some cases, we need valid indications are required to intervene in a natural childbirth. For example, when a cesarean section is necessary to keep a mother and newborn alive. But as we know, there are just a few cases that we need these kinds of operation. But unfortunately, as you can see in this bar chart, the percentage of live births delivered by cesarean section have risen in all parts of the world. For example, in Western Europe and Africa, Asia, it doesn't matter. In 2010, a review study showed that out of 137 countries, 54 countries had a cesarean rate of below 10%. 41 countries between 10 and 15%, while in 69 countries, this rate was recorded a bit greater than 15%, which is higher than the acceptable rate according to WHO. Notably, in that study that I mentioned the name of this study here, Iran with 41.9% was recorded as the second country with the highest rate of cesarean after birth. Other studies in Iran show that more than 70% of cesarean section had no valid reason. 92% of such cases were performed following the request of pregnant women who were scared or concerned about the side effects of NVD or natural labor. For example, Shariat et al. In 2002 and Endron et al. In 2017 showed that, respectively, about 71% and 81% of mothers choose the cesarean section over than natural childbirth just because of tocophobia. Fear of childbirth or tocophobia may result from fear of the pain of labor, prenatal injury, and newborn death or injury. Fear of childbirth is mainly associated with increased labor pain, prolonged delivery process, and unpleasant labor experience. This fear could also be due to postpartum depression, postpartum anxiety, and also it can increase the surgical interventions like section and negative delivery outcomes. It is of note that fear of natural childbirth is more common in periparous women, as I said before in the first slide. Fear of natural childbirth is an unexperienced event, and this group of women internalize other unpleasant experience of women, so they insist for having a cesarean section. So the fear becomes a fact cycle of birthing negatively, and leads to increase the rate of repeated cesarean sections swiftly. That is one of the important negative consequences of this problem. Okay, what should we do for this problem? Let's now we are going to talk about some beneficial strategy for decreasing this problem. According to articles, educating and preparing pregnant women for normal delivery is a great strategy to decrease the fear of pregnancy and also the rate of cesarean section too. The prenatal period's education provides a valuable opportunity to improve misconception and misinformation about childbirth. Reducing the fear of and also increase the self-efficacy of childbirth is one of the important achievements of this education. Unfortunately, for many years in Iran, prenatal care included only measuring height, weight, blood pressure, and listening to heartbeat, just this. Education and consultation programs on labor and better pregnancy control have been inadequate. For this reason, the Ministry of Health in Iran has been providing childbirth preparation programs for pregnant women in 2014. This program is called Preparation for Pregnancy Period or physiological delivery. Classes start at twins week of pregnancy and are 8 sessions long and finish at the 13th of pregnancy. As you can see in these photos, we are trying to apply various relaxation techniques and education and training methods. These courses aim to relieve pain during pregnancy and also reduce the fear and anxiety of mothers. Various techniques and muscle and mental relaxation methods are examples of methods in childbirth preparation programs. After the implementation of this program, the index of cesarean section in country was decreased about 6% immediately, and then it was constant for a long time. And about the effect of prenatal care courses on childbirth fear, I gathered some articles that here we wanted to review them and discuss about them. In the first one, they have shown that the level of anxiety during pregnancy and childbirth differs between case and control with a statistically significant result. That was great. In another study, the score of anxiety, the pain in the transition phase and the pain in the active phase and the episiotomy pain were different statistically between the two groups. And also, we have seen a positive effect of courses of pregnancy preparation and the duration of labor and reduction of the cesarean section rate, and the positive effect of postpartum fatigue, depression, and backache resulting from pregnancy. I should mention that fears for controlling this fear, there are some factors such as care workers, for example, midwife or obstetrics, or courses on childbirth preparation. Information level of childbirth is so important, and applying relaxation techniques during childbirth and labor, and most importantly, psychological support from family and medical staff that Dr. Mustofi mentioned in this previous lecture. It is so important, and they have a severe impact on the level of fearing and courage of women. These studies are in the line with the WHO study, which investigated on 4,000 American women in 1988. The results show that the use of breast and massage techniques reduced the mother's fear and also pain and also rate of cesarean section and other complications. The final report included that the important cause of success is participate in the pregnancy period courses comprehensively and coherently. But on the other hand, we have seen some studies that they have shown a vice versa results. For example, according to Mehrabadi study, the fear in trained women of the intervention group increased significantly compared on the control group. It was so strange. And also, in another article, the post-training score of fear was increased in trained women. And unfortunately, in some study, we have seen the cesarean section of the group untrained was unfortunately different. It wasn't different with the untrained group. It was suggested that the course's starting time and also little use of appropriate training and relaxation techniques and different communities' culture, it is so important, may explain the observed inconsistency for having and watching this vice versa result. I should mention that According a literature review in 2020, it reported that only 30% of Iranian pregnant women participated in this national program. Their lack of knowledge and access is one of the main reasons withholding them from participating in this national program. This program has been running for about 7 years, but unfortunately, it applied just in some of measures Iran's cities. As a conclusion, I should mention that to decrease the rate of cesarean section and the fear of natural childbirth, we need long-term programs. To improve negative attitudes towards NVD, we needed such programs that these classes started and was available for pregnant women and also for care workers who deal with NVD. It is so important, terrain for trainer. Implementation painless delivery techniques such complementary medicine and aromatherapy, childbirth at home and in water, they are amongst methods that lead to success in most countries. And we hope that the adequate number of healthcare centers that they applied physiological delivery services increase in all cities of the it was accessible for all women in villages and in the cities. And also, we advise on further research on developing new childbirth control, for example, hypnosis, auricotherapy, acupressure, and massage, how we can and how much we apply such these methods in our pregnancy. And I should mention that it is so important using midwife counselors. Midwife counselors play an influential role in reducing fear and anxiety and changing the inappropriate culture of elective cesarean section. It is anticipated that a combination of midwifery knowledge and also counseling technique, which is a skill offered by midwife counselors, can considerably identify, manage, and treat tocophobia. Thank you for your attention. I hope it was clear and it was useful for all of you. And also, I wanted to say thank you to Media Medical and also Media Indonesia for getting this opportunity to me for having been here and present this article. Thank you. I'm ready for getting your question if we have enough time.
Okay, thank you, Midwife Fatemeh. As a woman, we should know that a pregnancy is psychology and normal for every woman. So we do not need to.
Thank you.
We do not need to fear. Baiklah, kita lanjutkan ke narasumber yang ketiga, Bapak Kamal Kasra. He is a lecturer at the Faculty of Public Health Universitas Andalas. He completed master degree of quality improvement in healthcare at Newcastle University, Australia, and philosophy doctor of community health at University of Kebangsaan Malaysia. He has served as head of health promotions and community empowerment section at the Provincial Health Services in West Sumatra, Indonesia, 2003 until 2010. Last year, he also been trainer of IMO-DEMO training for village posyandu cadres in Padang Municipality. Today, he will explain about prepare a healthy family to form readiness to be a wonderful parent. Kepada Bapak Kamal, kami persilahkan.
Thank you very much, Leila. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah. This afternoon, I'm very happy to join us. Thank you for your attention and an invitation for me for this session. Thank you, Excellencies, for the whole participants, especially for the speakers from India and Iran. Okay, let's for children growth rate zero stunting by 2030. Okay, have come to prepare a happy family to form readiness to be a wonderful parents. Hello, but this session I choose the special subtopic about the collaborative strategy among public health, nurses, and midwives in health promotion to prepare the teenager for healthy marriage. Fatemeh, Kasra, from Indonesia. Yes, if someone call me, can call 081374499413 and call and send email by kamal@gmail.com. Now, I have to start from the what is the health promotion? The promotion is a process enabling people to place control over and improve their health. And then the combination of educational and environmental support for action and conditions of living productive to health. The goal of the health promotion is to develop the community behavior changing to the clean and healthy behavior. As we know until now, many problems of the cases include COVID-19, but right now we speak about how to prepare the teenagers to achieve the healthy family in the future. What is the reality of teenagers behavior in marriage preparation? Impossible right now. Up to now, sometimes many teenagers lack of information. What they have to prepare? Lack of knowledge and lack of capability to access the applied information fully. The last one, lack of facility where they get some information and then to ask any information. So what should they know before getting married? As we know, midwives and then the other speaker also say to build the physical health. And then the second one, to prepare psychological health. And the third one, to develop social health. What does it mean? To build physical health, as we know, nutrition, physical activities, exercise nutrition, such as eating patterns, sleep patterns, to anemia prevention and also stunting prevention in the future when they got married and when they deliver babies. The second one, to prepare physiological health. Many teenagers are not ready to get pregnant and sometimes also insist about a childbirth and they're not willing to be breastfed because they want to be still happy and then still like smile like teenagers, not like mothers. Still, the third one, to develop social health. If we go, inability to adapt to a new family to dysfunction, or they don't know what about the mother, how to be adapt there. My husband, how about my mother-in-law and father-in-law? There is problem for them after get married. what should health providers do? As we know, nurse, midwives, and health provider, and public health provider, all of us working together in the field. We hope to do that, but I think it's not simple to say. Yeah, simple to say, but not easy to do. We also to be a caregiver, educator, advocate, and researcher. So, what the nurses to do? What midwives? What the public health can do? Come on. Nurses can educate, especially for genital hygiene, psychological to prevent genital tract infection, and such as many problems have to advise from nurses in the field. But what about the midwives? Also, many problems. How to prevent some problem in the mother's pregnancy, like intrauterine growth retardation, intrauterine fetal death, low birth weight, and will be stunting up to low birth weight. So, what about public health? The public health providers maybe can advise many people in the fields, in the posyandu or in the puskesmas area about nutrition, to manage using social media negative effect, to advocate key person in the field, and many them. So, how to collaborate among nurse, midwives, and public health providers? The first one, can teenagers posyandu development? The second one, to coordinate with the parents, teachers, and religious leaders. As we know, Indonesia, most of us are religious peoples. So sometimes we forget to join with the religious leader to advocate and to educate people, especially for family and a teenager. Yeah, we know Indonesia have a special teenagers posyandu, but what about reality now? That is developed or no? So the second one, maybe we need to use media. We know special media, social media, the traditional media, electronic media, and print media. We know the social media, many information, but sometimes hoax. The hoax, but many teenagers follow that information. So there is our important one to do. Let's collaborate among nurse, midwives, and public health provider. So what is the promotion objective? So because when we do the health promotion, let's try to, there is important one, to inform, to advocate, to persuade, to motivate, to entertain, to inform easygoing. They just say inform, okay, I many time to come to visit them, teenagers and then teenagers group or mothers group, but only inform. But about the leader in the village or in the town, there is advocate or no? And then also to persuade by time, and then to motivate. So the last one, very important in health promotion, is to entertain. Because to entertain, important one, to make it easy to receive our information. The last one, to inspire. If all of them collaborate together, inshallah, will be the success to be achieved. The teenagers to be mothers in health. It's needed the different strategy to achieve each objective. So, what should be done? The first one, don't forget that all participants, maybe you are a nurse, you are a midwife, or a provider, or public health. Don't forget the first one, health literacy. You have to have skills, knowledge, and motivation. It's important one. Some of the health provider many capability to do, and then have many knowledge, but less motivation. So the second one, create this simple message. Some of us to explain many message in one papers or in one poster, but very crowded. Nobody understood or nobody interested to see that. The third one, do a collaboration strategy. So, what is the health literacy? Skill, knowledge, motivation, and capacity of person to access, understand, appraise, and apply information to make effective decisions about the health and healthcare and take appropriate action. So, what the health provider need? Okay, the first one, self-confidence. Without skill, maybe self-confidence impossible. Second one, communication. As you know, communication, we need voice, we need verbal, and we need visual. Not only voices, not only verbal, but combined voice, verbal, and visual. The third one, advocacy. So the last one, using suitable media. As we know, we have a poster, we have a brochure, but in a way and when we have to use. Okay, so potential in health promotion. As you know, the third one, the among of us, we have self potential. What is that? Face expression. Face expression can explore based on our understood or didn't understand or our say. The second one, body language, and the third one, vocabulary. So we may not repeatedly in one word. So what about using media? Caregiver should understand how to use media. When and where we use the poster, leaflet, and flip chart, etc. For example, like this, when home visit, some of provider come to the village, but just put the poster on the flat, on the mat, but no thoughts when talking. Much better use like this. Yeah, you can keep the flip chart and then explain one by one in front of the small group. Don't be use the flip chart in the big group or in the class. So the last one, flip chart could be used in the group discussion. Okay, that's all my presentation today. Back to Rima. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Bapak Kamal. Materinya sangat komprehensif dan sistematis.
Alhamdulillah.
Jadi kita tahu bahwa peran dari tenaga kesehatan masyarakat, terutama menggerakkan untuk memberikan promosi kesehatan kepada masyarakat agar bisa untuk mempersiapkan generasi yang sehat dan kuat. Dan juga peran tenaga kesehatan masyarakat dalam mengajak tenaga kesehatan yang lainnya untuk berperan aktif dalam melakukan kolaborasi. We invite the last speaker, Ibu Tiyas Kusumaningrum. She is lecturer and program coordinator for Bachelor of Nursing, Department of Maternity and Pediatric Nursing, Faculty of Nursing, Universitas Airlangga. She completed her Master of Nursing at Universitas Airlangga. Her areas of interest are maternity nursing, women's health, and reproductive health. She has had the opportunity to occupy several important positions, including the head of maternity nursing divisions, journal manager, and faculty ambassador at the Faculty of Nursing, Universitas Airlangga. She has also been registered as a member of East Java Region Indonesian Maternity Nurse Association. She will give the presentations on independent postpartum care and increasing self-confidence to be a young mother. Kepada Ibu Tiyas, kami persilahkan. Kami ingatkan kepada para peserta untuk bisa mengajukan pertanyaan dengan mengetikkan nama, kemudian institusi atau asal kota, dan pertanyaan tersebut ditujukan ke pembicara yang mana. Silahkan ajukan pertanyaan melalui kolom Zoom atau kolom YouTube. Baiklah Ibu Tiyas, kami persilahkan.
Oke, Assalamualaikum warahmatullahi wabarakatuh. Good day, everyone. To seniors, colleagues, and all seminar participants. Also, I would like to say thank you for the committee and also Ms. Rima. It's an honor for me to participate in this event, and hopefully the knowledge that we discuss and learn today is useful for improving the health in the community. So I will like to share my presentation. Wait. Sorry. So on this occasion, I will share about postpartum care at home and how to increase the confidence of young women. First of all, my presentation today will talk about the challenges experienced by postpartum mothers and postpartum care while at home, and also increasing self-confidence for young women. I think all of you already knows or learned these topics a lot, but I would like to just remind again about the topic. So first, I want to share some of the challenges that are often experienced by postpartum mother. And why am I discussing this is that because we will not be able to provide care without really understanding what the mother will face during this period. So the postpartum challenges itself, the postpartum itself is an inseparable part of pregnancy and childbirth. And in these periods, needs to be prepared before the delivery, as the other presenter already mentioned before. These periods need to prepare and to make mothers get a satisfactory postpartum experience. Some of the challenges faced by mothers include breastfeeding, baby care, physical care, and how the role transition and make the family planning and health issues, other health issues related to postpartum, such as bleeding, preeclampsia, infection, before the not so good as a baby outcome, and not to mention the working life and of course the work from home, because work from home for working mothers, breastfeeding and also working mothers become more challenging than what it's already had. So when we talk about breastfeeding and feeding, we cannot forget the term about the exclusive breastfeeding. So exclusive breastfeeding has received tremendous attention in the last decade. Exclusive breastfeeding is also scientifically proven to play a or good role to improve baby's health. And the development of science and technology then provides various facilities for mother who wants to breastfeed exclusively. However, the achievement of exclusive breastfeeding is still quite low. Based on UNICEF data in 2020, the world average achievement is less than 50%. Even in Indonesia, the achievement of exclusive breastfeeding is actually 66% in 2020. So I think this is a joint success of both health workers, the community of exclusive breastfeeding activists, and of course, mothers who have the commitment and ability to make this happen. So give mother applause for this achievement. So we understand that breastfeeding is a physiological things, but that doesn't mean that breastfeeding can be done without difficulties. The condition of the mother and baby, as well as the environment, greatly affected the success of this breastfeeding. Yeah, and there are various things that prevent mother from breastfeeding. Many mothers complain of insufficient milk production, even when the postpartum only less than 1 week. In fact, physiologically, the amount of breast milk production has been adjusted to the needs and age of the baby. And of course, breast milk production can be increased by fulfilling adequate nutrition and fluid, as well as emptying the breast regularly. Yeah. And then during the breastfeeding period, more than 40% of mother experience breast engorgement in the first week of postpartum. It's usual. And this is usually caused by the poor breastfeeding patterns and technique, and sometimes it's because the difficulties in baby latch, yeah. And breast engorgement can cause pain, which become an unpleasant experience for breastfeeding mothers. Another challenge that mothers usually face is the inverted or cracked nipple. Inverted nipple problems are often found in the postpartum period because previously the mother maybe did not pay much attention to the shape of the nipple. And this is the reason for the midwife or maternity nurse to provide education related to breast care even before pregnancy. Cracked nipple usually occur during breastfeeding due to improper care, improperly baby latch, and dry nipples due to improper use of hygiene products. Infant reflex also play an important role in successful breastfeeding, but in premature babies, physiologically reflex may not be well developed, so the mother needs to provide appropriate stimulation so that the baby can suckle well. Of course, this takes time and sometimes cause frustration to the mother. So for the baby care, caring for baby is a challenge for parents, both new parents and those who have had children before. Of course, new parents may experience more difficulty in doing this because they do not have direct experience of caring for babies. Handling, bathing, burping, or calming the babies require hands-on experience, so parents can be more flexible in carrying out their role in caring for babies. Sometimes we jokingly say that when we putting the baby to bed and putting the baby to sleep, it's like the parents are on the battlefield full of mind. So one wrong step and then the baby will wake up and cry, and it became stressful for the parents. Yeah. But what we need to educate to parents is that babies is not only about sleeping. So baby needs to be awake and stimulates to make the development of their body and brain is increasing. So don't make the baby sleep always, but you need to do the stimulation too for the baby. So the baby is awake is okay. Yeah. So for the balance of physical self-care, when the baby is born, the main attention usually on the baby. So people around the mother and even the mother herself devoted attention to the baby and the needs of the baby. But sometimes forget about the baby, about the mother who has made it through pregnancy and childbirth. In the postpartum period, it is very important that the mother's self-care is well managed. The challenge faced by mothers include managing rest period, adapting to physiological changes such as local discharge and uterine involution, which may be accompanied by pain. Mothers are also likely to experience psychological changes due to hormonal fluctuation, as well as a desire to immediately return to normal weight. So when we talk about the role transition, the transition of motherhood is a complex matter that is related to the physical, psychological baby condition and their relationship with the people in their environment. So based on the concept of Reva Rubin, an expert in maternity nursing, the transition of the role of being a mother involves a psychological adaptation process consisting of finding in by being attached to and achieving a maternal role and comfortable and the mother itself comfortable with the role. This stage is known as the taking in, taking hold, and letting go phases. These stages, according to several studies, are closely related to each other. And it is possible that a mother who is in the taking in phase or taking hold phase also has another phase component in the phase that she is experiencing. Rubin's students, Ramonate Mercer, is a really famous nursing theorist in nursing, developed the concept of Rubin and incorporated the interaction component into her theoretical framework. Mercer argues that the role and identity as a mother is highly dependent on maternal factors such as self-concept, mother's experience and health, condition of baby's health and behavior, mother relationship with her partner, environment, and social support received by the mother. Another challenge is family planning. So when we talk about family planning, of course, it is related to the choice of the couple. The choice of contraception sometimes confuse mother because they do not know when to start contraception, the appropriate method, or how to access the contraception, and who will make the decision regarding the contraceptive use. Most couples rarely discuss this, especially if their knowledge of contraception is lack, or if there are some beliefs and myths about contraceptive use. And sometimes in certain situations, mothers and partners do not have enough time to consider what is the best option that they would choose to be applied on mother or for the father. Another challenge that some disadvantaged mothers have to face is the health problems that occur during postpartum, such as bleeding, preeclampsia, infection, poor infant outcome, twins, and etc. Health problems that occur during the postpartum period can certainly slow down the process of becoming a mother. And sometimes this situation causes the mother to experience psychological stress that interferes with the relationship between mother and baby or mother with the partner. Comprehensive treatment and counseling will greatly help mother and their partner through these difficult times and other postpartum health problems. Next, I will explain about postpartum care at home. So before conveying about home care by mother, I would like to remind my health professionals, colleagues about the main principles of postpartum care. These principles are continuing evaluation and management of care and provides relief from physical discomfort, provide assistance with breastfeeding, facilitation of parenting, assessment of the baby during a home visit, provides anticipatory guidance and instruction and screening for complication of the puerperium. WHO also makes some recommendation for the postpartum care during the COVID-19 pandemic. The recommendation are maintaining infection prevention control measures like proper hand washing, using masks, and implementing physical distancing. And then postnatal visit and examination of the newborn should follow the WHO guidelines on danger signs, weight monitoring, and also feeding. Postpartum care should include telemedicine. So telemedicine is quite famous now, and also a lot of our midwife and nursing use this telemedicine to access the patient and to give education to patient. Not only telemedicine, digital platform, mobile health application, and safe community outreach needs to be done. And the mother's mental health and well-being should be evaluated, along with recognizing signs of illness and ensuring care of micronutrient supplementation, counseling of lactation, contraceptive health environment, screening and support for intimate partner violence, because the intimate partner violence also increased during the pandemic, and also the healthy diet during postpartum period. And lastly, all mothers should receive emotional and practical support to enable them to initiate and establish breastfeeding. Home care for mothers, like what was previously conveyed by Dr. Leila. So it is necessary to provide education and training for mothers, family, or anyone who will provide support for mothers. Management of energy. Sometimes we need to educate how mothers do the management of energy. We need to educate that mother needs to adjust with the baby's sleep and wake cycle, and that mom needs to have time for herself to rest and enjoy her time alone. Of course, this requires cooperation from the partner, and the partner can help take care of the baby while the mother is resting, as well as assisting the mother in doing household chores. Couples need to share tasks so that the transition of parenthood is successful. Especially in Indonesia, postpartum mothers are usually accompanied not only by their husband, but also by their mother or their mother-in-law, who sometimes give inappropriate recommendation for the mother's well-being. Midwives or nurses need to provide education and understanding to parents-in-law regarding proper postpartum care, so the mothers will gain benefit from the support. As I mentioned before, family is actually a source of potential support, but actually when it's too intense and too demanding, then the mother not going to feel supported, but will feel burden from the support. Postpartum mothers do have to be able to maintain self-hygiene. But some mothers who give birth by cesarean section may be experiencing a little difficulty in bedding and threshing at the beginning of their postpartum period. So the partners needs to provide assistance in cleaning the mothers while at home. And it is it is very important to mothers in maintaining a balanced intake of nutrients and fluids during the postpartum, because mothers need to recover themselves as well as to provide breast milk for their babies. For this reason, mothers should eat a balanced diet. Usually the choice of food is in the maternal health book that is given during the pregnancy. We can ask the mother to check in that, and we need to communicate, building the communication with mothers, which the choice of the nutrition. In addition to nutrition and fluids, mother also needs to do light to moderate exercise that is adjusted to the postpartum period that is being passed. And postpartum mothers can also get massage to provide a sense of comfort and also increase relaxation for the mother. After all, the self-care that can be done independently by the mother or with the help of her husband or family members, it is necessary the mother knows about where she can get advice and professional treatment for the physical and psychological problem occurs during the postpartum period. This is an example of breast care. Breast care is actually very simple. Mothers must use a bra that is the right size and clean. And after the third day, breast milk production usually increase, as well as the hormone of oxytocin, so that milk is released without involuntarily. So when this happens, then mothers need to put a breast pad on. So mothers need to change the breast pad regularly. Even when taking a bath, mothers still can clean the breast, but needs to avoid using soap on the nipple area to prevent the nipples from drying out. And this is important so that the nipple is not easily lacerated or cracked. In addition, mothers also need to pump the breast milk regularly so that emptying the breast occurs and stimulates another milk's production. This can also prevent the mother from engorgement, or we call it bendungan ASI in bahasa. This is some example of slow to moderate exercise for mothers. You can do some of range of movement, and if the mother is strength, have a good strength, maybe we can do a plank, a simple plank, not too long, maybe 10 to 20 seconds. Repeat it in 2 or 3 cycles, it's enough. Of course, you have to, the mothers needs to have a warming up first before doing the exercise to prevent strain. This poster give us example some of massage. From how we do the massage. One thing needs to be noted is that we don't press the skin too strong, because the principle of giving massage is to give pleasant feelings, and we produce the pleasant feeling if we give a good stroke to stimulate the peripheral nerves. If we press too strong, and then what we press is not peripheral nerves, but that is the pain nerves. So the patient will feel pain, not comfort. For increasing self-confidence, we need to, the mothers need to maintain good relationship with the husband or partner, and also family and friends. Mothers need to seek knowledge from reliable sources about baby care and set realistic target. Mothers need to have a realistic target. For example, if mother cannot have I want to decrease my weight 5 or 10 kilogram this week. So it's impossible target. We need to train the mother how to set the realistic target, and we also encourage mother to do the positive self-talk. So positive self-talk, some research already have a positive outcome to increase the self confidence and also self-trust. And then join mothers or parents community also help, and mothers need to have a hobby. Needs to do the hobby maybe regularly, maybe 1 or 2 times a week is good. And then mothers give reward for their own achievement during the postpartum periods. Not only setting the target, but also give achievement for achieving the target. That's very, very important. I think that's all from me. This is a reference. Thank you for your attention and also your participation. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Ibu Tiyas. Health professionals should try to overcome various challenges during postpartum, including baby care, family planning, breastfeeding, and physical care. Okay, we come to the end of the sessions. The session is discussions, and there are many questions that have been collected. And I will combine the several questions because almost the same. And the first questions addressed to Midwife Fatemeh. This question is from Erlangga Fikrianto from Apikes Bandung et al. The question is, tocophobia can cause negative impact during pregnancy. As a midwife, please explain important strategy to handle the situations, especially in pandemic era, and how to support pregnant women in different culture. Please, Midwife Fatemeh, to give the explanations. Mohon bantuannya kepada panitia untuk bisa mengaktifkan suara.
At first, I would like to say thank you for asking this fascinating question. I think this question has 2 parts. And the first part is how we can apply such courses in the COVID-19 pandemic, yes. And then how we can consider some cultural and communities difference in different societies. So now we are suffering from COVID-19 pandemic, and we have to change our programs according to this situation. For example, now we are applying most of our courses, educational courses in online, in different kinds of applications for pregnant women, and try to use some exercise courses just in privately, for example, a midwife and a pregnant women, that we don't have a concern about getting disease. And I think it is so essential that we increase our psychological support and consulting meeting for pregnant women and also their family, because their husband, their family should support these women that now are scared about a lot of things, not only about childbirth, about situation of the hospitals that maybe they are not safe at the moment. And also another part of this question that was about considering the community culture. Yes, exactly as Dr. Mustofi mentioned in the first part of this speech, we have a different kinds of community culture, and at the first, I think we have to have a counseling meeting with that group of people and consider their ideas about how they want to apply and how much they afraid about the one reasons, and then we can apply such a special program for that group. For example, in some group of people, we can apply music, different kinds of music for them, and some group of people prefer to apply just Quran for them, and being calm with a message of God. So it is essential, you know, and familiar with your group completely. I hope I answer it completely.
Okay, thank you, Midwife Fatemeh. The next explanations. We come to the second questions. This question addressed to Ibu Tiyas. Pertanyaan ini dari Aisyah dan kawan-kawan. Pertanyaannya yaitu, how to overcome health issues related postpartum, such as infections, because as a nurse, we need to control that issues to prevent complications. Mohon kepada Ibu Tiyas untuk menjelaskan.
All right, thank you for the questions. So the question is about overcome the infection, how to prevent the infection and how to overcome it. I think first of all, this is multisectorial. For the first, it's about the treatment during the patient in the hospital or in the primary care where they give birth, and also in the society where the mother is living. So the sector needs to be prepared for the mothers correctly. So in the hospital or primary care, we do the aseptic treatment. So especially for the infection, it's really rarely happens in the hospital or in the primary care. But during their time at home, sometimes the mothers use different kind of products, or maybe the sanitation of the water and maybe the clothing. Yeah. So sometimes those kind of hygienes can affect the infection. Can affect to infection. Yeah. So and then how to prevent it? It's the first thing is education. Yeah. Well, how we educate the patients, how to do the for hygiene, and how to maintain the nutrition to provide barrier for the mothers to getting infection. And also we need to evaluate and talk with the mothers and family. Do they have some kind of traditional treatment for the for hygiene? Sometimes in some tradition we give some what do you call it? Maybe in so we call it jamu or ramuan that is being applied to the wound of the mothers, not only for the mothers give birth in normal birth, but also for the cesarean section. Sometimes they apply the traditional mixture. So we need to discuss about that thing, and we need to educate people, and not only to say don't do this and don't do that, but we need to talk with them what is being good and what is being not really good, and how they can still do the traditional but not affecting the health of the mothers. I think needs a lot of communication and education, and sometimes we need to provide kits. Yeah, sometimes we need to provide kits, hygiene kits for the mothers if we want to them to have a good for example, wound treatment. Yeah. Thank you.
Ya, terima kasih Ibu Tiyas atas jawabannya. Ini masih ada satu lagi Ibu untuk Ibu Tiyas dari Devi Putri Gitasari dari Boyolali. Pertanyaannya Ibu, bagaimana caranya mengatasi stres selama pandemi ini, terutama bagi ibu yang baru saja melahirkan?
Thank you for who's the name?
Gita, Ibu. Mungkin bisa dijelaskan
Gita,
dengan bahasa Indonesia juga, Ibu, satu pertanyaan.
Bahasa, I will explain in bahasa. Yeah, I'm so sorry for other speaker. I will say it in bahasa. Jadi caranya kita menghindari stres selama pandemi, terutama pada ibu postpartum, tentunya adalah berkomunikasi dengan pasangan ya, dan juga keluarga, membangun komunikasi yang baik. Membangun komunikasi yang baik itu bisa membantu, karena dengan komunikasi yang keluarga ataupun suami juga bisa memahami apa yang ibu itu rasakan, begitu ya. Bagaimana ibu itu ingin, mungkin seperti yang saya jelaskan tadi, ada pembagian tugas gitu, ada asistensi selama di rumah. Memang agak sulit ya kalau nanti misalnya itu adalah nuclear family, jadi family-nya itu hanya terdiri dari ibu, ayah, dan bayi, seperti itu. Nah, kalau ibunya sih dikasih cuti selama 3 bulan misalnya, tapi kan ayah mungkin hanya 2 atau 3 hari sudah kembali bekerja. Nah, ini memang menjadi suatu tantangan tersendiri bagi ibu, apalagi ini masanya masa pandemi, di mana ibu ini tidak bisa mungkin mengakses support dari teman atau yang lain. Tetapi tentunya karena sekarang juga zamannya teknologi ya, mungkin bisa kita melakukan komunikasi ya dengan orang-orang yang terdekat atau yang menurut kita bisa memberi support kepada kita. Jadi tetap membangun komunikasi itu. Kemudian memberikan waktu tersendiri bagi ibu ya. Jadi ibu itu perlu me time lah istilahnya gitu ya, me time. Kalau misalnya dia hobinya nonton drakor ya, berarti harus ada me time untuk nonton drama Korea gitu. Ngomong sama suaminya, ya aku nanti kayak nggak stres gitu, aku minta waktu 1 jam aja untuk nonton misalnya apa My Roommate is Gumio misalnya, kayak gitu ya. Jadi minta waktu 1 jam aja, jam berapa nanti kita disepakati bersama. Intinya adalah komunikasi ya, kesepakatan bersama, bicara, berkomunikasi. Kalau saya yakin, karena misalnya pada ibu-ibu muda ya, ibu muda, suami istri masih ideal gitu ya, cara pandangnya masih ideal, masih saling mensupport, saling rasa sayang cintanya itu masih in the honeymoon stage gitu ya. Itu saya rasa harusnya bisa menerima gitu ya. Jadi suami juga bisa menerima bahwa istri butuh waktu untuk dirinya sendiri. Karena seorang istri itu bukan hanya istri dan ibu, tapi seorang istri adalah seorang individu. Nah, seorang individu yang membutuhkan waktu untuk dirinya sendiri, untuk memahami apa yang terjadi dalam kehidupan. Jadi itu caranya supaya kita terhindar dari stres. Ya. Dan melakukan hobi-hobi ya tadi ya, hobi-hobi. Exercise itu juga mengurangi stres ya. Jadi hormon kortisol itu bisa dikurangi dengan melakukan exercise. Jadi kalau kita kira sudah stres, coba lakukan gerakan-gerakan low to moderate untuk bisa menghilangkan stres itu tadi. Terima kasih.
Ya, terima kasih Ibu Tiyas. Kita langsung ya ke pertanyaan yang terakhir dari Suci Universitas Airlangga dan kawan-kawan. This question addressed to Bapak Kamal. The question is, according to pandemic in Indonesia, there has been an increase in the number of marriage and pregnancies, but the mortality rate also increased. How we as the public health professional motivate or give health promotion to young girls? Does delaying pregnancy become one of the best choice? Thank you.
Thank you very much for the question. Excellent question, but hard to answer. I think on the pandemic, COVID-19, easy for us to coordinate or contact with the other people by using the social media or like a mobile phone or like WhatsApp and others. But especially sometimes Ibu Tiyas and Fatemeh, we only the health provider in the Puskesmas or the ground level focus on the COVID-19.
Yeah.
You know, okay, let's focus on 19, but save the mother's pregnancy also. Yeah, and then what about the teenagers? Now they focus using the social media and the mobile phone every day. But at that time, they forgot there's many chances for them to read how to prepare to be mothers in the future, how to they exercise like Tiyas say. They also exercise and also nutrition strategy, how to what the food good for the healthy or no. What about the how about the coordinate with the other peoples like our provider also advise them. For example, it's easy for us also by using the coordinate with the student in the university. They also in the field right now. We can call them how to advise many mothers to protect their kids or their teenagers to be able to select what the information good for them, especially for they're healthy or not good. So I think it's very important for us. But sometimes mother also busy by themselves only. They focus for their activities but forget the kids, what they do. Are they happy? Oh, my kids now know the picture, no can watch the TV or can watch the YouTube, but they don't know what the side effect for the social media if they don't understand. So I think by using the student or by the health provider, can we collaborate together how to protect the teenagers by using the educate and then health promotion by using also like print paper, like poster, like brochure. I think so. Terima.
Thank you, Bapak Kamal.
Yes.
Okay, thank you so much. I really appreciate for the great explanations from all of the speakers today. And now, allow me to give the conclusions in Bahasa because the majority of participants come from Indonesia. Peserta seminar yang berbahagia, berdasarkan pemaparan materi yang sangat luar biasa dari narasumber 3 negara, ada beberapa poin yang perlu digarisbawahi. Pertama, tenaga kesehatan masyarakat merupakan penggerak masyarakat untuk mempersiapkan keluarga dan generasi yang sehat, serta berkolaborasi dengan tenaga kesehatan lainnya. Kedua, bidan merupakan fasilitator dan sahabat calon ibu yang memberikan asuhan kebidanan yang aman dan nyaman selama proses kehamilan dan persalinan dengan membentuk mindset yang baik. Dan yang ketiga, perawat berperan dalam memberikan asuhan keperawatan postpartum, terutama terkait dengan personal hygiene dan dukungan kesehatan mental ibu muda. That's all for the sessions, and thank you so much for the time and the change, and I will give it back to the MC. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you to the moderator and speakers who have delivered such a great presentation. Hopefully the discussion can widen our insights into how to plan a healthy family and to form a healthy and normal mindset of pregnancy, childbirth, and postpartum. So ladies and gentlemen, we have done the main session of the seminar. And now we would like to thank all the team, the committee has worked hard in this seminar, and the media partners who supported this event as well. Once again, we'd like to thank all the amazing speakers, Ms. Fatemeh Ghodsi, Ms. Leila Mustofi, Ms. Tiyas Kusumaningrum, and also Mr. Kamal Kasra. And we also thank all the audiences for joining the seminar, and we hope the discussion and all the knowledge we gain here can be insightful for us. Before we close this event, we would like to invite all participants in the Zoom room to take pictures together. So I will handle this taking pictures. So please be ready. And I'll be taking pictures in 3, 2, 1, smile. Again. I'm taking pictures in 3, 2, 1. Again, smile. Again, smile. 3, 2, 1. And once again, thank you for the attention, and we'd like to apologize for the mistakes and inconvenience. Keep staying healthy, and see you in the next event. Thank you so much, and Assalamualaikum warahmatullahi wabarakatuh.
Thank you,
Thank you, Fatemeh. Thank you, Tiyas.
Terima kasih, Tiyas. Terima kasih, Bapak Kamal.
Terima kasih, Imam. Terima kasih, Debbie. Successful.
Semuanya. Selesai semua.
Terima kasih semuanya.
Semuanya. Makasih semuanya. Oh, ini absensi lagi nggak ya? Nggak perlu. Terima kasih.
Baik, terima kasih.
Kata materi ya. Materinya itu 10. Itu 15. Tadi apa? Abu-abu panjang. Itu panjang M. Abu-abu panjang M tadi tuh itu. Panjang M.
Awalnya saya coba.
Kalau yang punya nggak ada masalah. 3, 2. Back.